Okay, let's jump right into this deep dive. Today we're tackling a condition called Brugada syndrome. It's oh, it's pretty complex and honestly a bit mysterious.
It really is. We've got some great source material to work through.
Yeah, using those notes and sources you shared, our goal is to unpack it all. We want to make it clear for you what it is, why it's often so hidden, and how it's managed.
Think of it like solving a puzzle within the heart's own electrical system.
Exactly. It's potentially life-threatening, which is serious, but the really surprising thing, it can affect people who seem completely healthy, often without any warning signs.
That's the core challenge. And it's important to understand, this isn't like typical heart disease from clogged arteries or anything like that.
Right.
Brugada syndrome is fundamentally different. It's a rare cardiac arrhythmia disorder. It's about the heart's electrical signaling.
So the electricity is going wrong somehow.
Precisely. Those electrical impulses that coordinate the heartbeat, they can become abnormal, unstable even.
And that instability, that leads to the biggest danger.
Absolutely. That abnormal activity can spiral into really dangerous, chaotic heart rhythms. The most critical one is ventricular fibrillation.
Where the heart just quivers instead of pumping.
Exactly. And if that happens, it can lead very, very quickly to sudden cardiac arrest.
Wow. And looking at the sources, this wasn't even really on the map until fairly recently, was it?
Correct. It was formally described back in 1992 by the Brugada brothers, hence the name.
And while it's labeled rare, the estimates seem quite broad. 1 in 2,000 maybe? Up to 1 in 10,000?
Yeah, the estimates vary, and there's a strong suspicion among specialists that it's actually underdiagnosed quite significantly.
Which makes total sense if it's hard to spot. The sources also mention some interesting patterns, like geography and gender.
Yes, that's right. It's identified more commonly in Southeast Asia, particularly in individuals of Thai, Filipino, and Japanese descent. And it also seems to affect males more frequently than females.
Interesting. Does that connect to the cause?
We think so. The genetic component, which we'll definitely get into, likely plays a big role in those patterns. But going back to what you said earlier, the real kicker is its unpredictability.
Right. It doesn't follow the usual rules.
No. It can affect people who look the picture of health athletes, young adults, even children sometimes. No warning signs related to typical heart problems.
And that unpredictability just carries right over into the symptoms, or often the total lack of them.
That's a huge part of the problem. Many people have absolutely no idea they have it.
So what are the signs, if they do show up?
Well, when symptoms do occur, they can be really vague. Things like fainting spells that come out of nowhere, syncope we call it, or maybe shortness of breath, palpitations, sometimes even brief seizures.
But those could be anything. Dehydration, stress, just being exhausted.
Exactly. They're so easily missed or just brushed off as something minor.
Which leads to the truly terrifying part. The sources were clear. For too many people, the very first sign something is wrong is sudden cardiac arrest.
It's shocking. That statistic from the National Heart, Lung, and Blood Institute really hits home. Up to 20, maybe 30% of sudden cardiac deaths in people under 40 could be linked back to Brugada syndrome.
20 to 30%, that's staggering.
It really underscores the silent nature of this threat. People are often walking around completely unaware until some kind of trigger event occurs.
Trigger event. What kind of things act as a trigger?
It's a surprisingly diverse list. A high fever is a really common one.
A fever. How does that trigger a heart condition?
It sounds odd, right?
Ugh.
But a fever can actually change the way those tiny sodium channels in the heart cells function, temporarily unmasking the underlying electrical problem.
Wow. Okay, what else?
Certain medications are known culprits too. Some drugs used to treat arrhythmias, paradoxically, but also some antidepressants, even certain antihistamines.
So common medications could be a risk.
Potentially, yes, in someone with the underlying condition. Also substance use, things like excessive alcohol or cocaine, and electrolyte imbalances, particularly low potassium levels.
So it's not just the genetics, it's this interaction.
Exactly. These triggers don't cause Brugada syndrome, but they can dramatically increase the risk of a dangerous arrhythmia if you already have that predisposition.
And another surprising thing from the sources, the highest risk isn't necessarily during intense exercise.
Correct. Often the highest risk period for sudden death events in people with Brugada syndrome is actually during sleep or rest.
That's completely counterintuitive for heart problems.
Mm.
Okay, so subtle symptoms, maybe no symptoms, weird triggers. Diagnosing this sounds like a real nightmare.
It is definitely challenging.
Yeah.
It's not straightforward. Diagnosis needs a careful clinical look plus specialized tests. The main tool is the electrocardiogram, the ECG.
Okay, the heart tracing test. What are doctors looking for specifically?
They're hunting for a very particular pattern, often called the Brugada sign or Groga pattern. It shows up as an abnormal shape, specifically in elevation, in a part of the tracing called the ST segment.
And it's in specific parts of the ECG.
Yes, usually most prominent in the leads that record activity from the right side of the chest, the right precordial leads. But, and this is the crucial part,
There's a catch.
there's a big catch. The pattern can be intermittent. It comes and goes.
So someone could have Brugada, get an ECG, and it could look totally normal on that particular day.
Precisely. Which is why often you need what's called a provocation test.
You have to provoke it. How does that work?
Under very controlled medical supervision, a doctor administers a specific medication, usually a sodium channel blocker like ajmaline or flecainide. This drug essentially challenges the heart's electrical system.
To see if it brings out the hidden pattern.
Exactly. It can unmask that Brugada pattern on the ECG if the underlying vulnerability is there. That 2023 circulation study you shared mentioned that up to 40% of suspected cases might need this kind of test for confirmation.
40%? That's a lot. So it's often hidden. Are there other tests involved?
Yes, definitely. An echocardiogram, that's an ultrasound of the heart, is usually done to check the heart's structure. Brugada itself isn't structural, but you want to rule out other issues.
Makes sense.
Then there's genetic testing, looking for mutations in the genes known to cause the syndrome. The SCN5A genes is the most common one implicated, maybe in 20–30% of cases.
Okay.
And sometimes more invasive electrophysiological studies are done, where catheters are guided into the heart to map its electrical activity directly.
Even with all that, the sources say misdiagnosis or delays happen often. I guess because the symptoms are vague and the ECG changes hide.
That's exactly it. The symptoms overlap with so many other things: fainting, anxiety, even normal ECG variations like early repolarization. It's easy to miss if you're not specifically looking for it.
So getting a specialist involved sounds key.
Absolutely. If there's any suspicion, getting a second opinion from a cardiologist who specializes in inherited arrhythmias, an electrophysiologist, is really advisable.
Okay, so diagnosis is tough. You mentioned the genetics, the SCN5A gene. Let's dig into that cause a bit more. It's mainly genetic then.
Primarily, yes. The root cause is usually genetic mutation, most often, as we said, in genes that handle the instructions for building sodium channels in the heart muscle cells.
The gates for the electrical current?
Basically, yes. These channels control the flow of sodium ions, which is critical for generating the electrical impulse. If the channels don't work right because of a mutation, the signal can become unstable.
Which is why family history is such a huge red flag, right?
It really is. The European Society of Cardiology data suggests if a parent has a mutation, each child has roughly a 20–40% chance of inheriting it.
That's quite high.
It is. So identifying a mutation in someone diagnosed is vital for screening their relatives, parents, siblings, children.
And does this tie back to the higher rates in Southeast Asia?
It's strongly believed to. Shared genetic ancestry likely explains that higher prevalence, though the precise factors are still being researched.
Okay, so the gene is the underlying issue. And those triggers, we talked about the fever, the meds, they don't cause the gene problem, they just set it off.
Exactly. They act like dangerous cofactors. They don't create the faulty channel, but they can make the existing electrical instability worse or, like with fever, directly affect how those faulty channels function, making the ECG pattern appear.
So knowing and avoiding those triggers is crucial for management.
Absolutely fundamental. It's a cornerstone of living with the condition once you know you have it.
To really understand the impact, the sources had that story. The 19-year-old athlete. Can you walk us through that? It sounds powerful.
It really is. You have this young guy, 19 years old, seems perfectly fit, athletic, collapses suddenly during a soccer match, just out of the blue.
The absolute last person you'd expect.
Right. And what happened next was critical.
People reacted quickly.
Yes, coaches, teammates, they knew it was serious. Called for help immediately. Paramedics arrived fast, and crucially, they had an AED, an automated external defibrillator.
And they used it.
They did. Delivered an electrical shock. And that's what restarted his heart. That's what saved his life.
Incredible. So what happened after?
Well, in the hospital, his ECG showed that classic Brugada pattern. And then genetic testing confirmed it. He had a mutation in the SCN5A gene.
Wow. So what does his story really teach us about Brugada?
It hits on so many key points. First, just awareness. This can happen to anyone, even young, fit people. Second, the absolute life-or-death importance of immediate CPR and getting an AED on someone fast. Without that defibrillation, the outcome could have been tragic.
Definitely.
Third, family history matters. It turned out his uncle had died suddenly at a young age. In hindsight, that was a huge red flag. Maybe could have led to earlier screening for him.
So that family connection is critical information.
Hugely important.
Mm-hmm.
And finally, stories like his, they raise awareness. They make the case for having more AEDs available in schools, sports fields, public places. They push for screening.
They make it real, not just statistics, which leads us right into prevention and management. How do you prevent sudden death from this?
Well, it's really a combination of things. Education is the foundation, like you said,
Right.
making sure athletes, families, coaches know the potential signs, know about family history risks, and advocate for checkups if needed.
Are there official screening recommendations?
Yes, groups like the American Heart Association suggest ECG screening for people who have a family history of sudden unexplained death or who've had concerning symptoms like fainting.
There's a debate.
There's ongoing discussion about whether routine ECG screening for everyone, like all young athletes, is the right approach. You have to balance finding the rare cases against the cost, the resources, and the anxiety that false positives can cause. It's tricky.
Okay, so for someone who is diagnosed, what does management look like? It can't be the same for everyone, right?
No, definitely not. It's very personalized, based entirely on their assessed risk level for having a dangerous arrhythmia.
So low risk versus high risk.
Exactly. For individuals considered low risk,
Mhm.
maybe they have the ECG pattern, but no symptoms and no significant family history management often focuses on lifestyle adjustments.
Like avoiding those triggers we talked about.
Precisely. Rigorously avoiding known trigger medications, treating fevers aggressively, limiting alcohol, avoiding cocaine, maintaining electrolyte balance, just living a generally heart-healthy life while being vigilant about those specific risks.
And for people deemed high risk, maybe they've fainted or worse, survived a cardiac arrest.
For them, the cornerstone of treatment is usually an ICD, an implantable cardioverter defibrillator.
The internal defibrillator.
Yes, it's a small device implanted under the skin, usually near the collarbone, with wires going to the heart. It constantly monitors the heart rhythm. If it detects a life-threatening arrhythmia like ventricular fibrillation, it automatically delivers an electrical shock to restore a normal rhythm.
It's like having a paramedic inside you 24/7.
That's a good analogy. It's a lifesaver for high-risk patients.
Are there any medications that help manage the condition itself?
Sometimes. A medication called quinidine can be effective for some patients. It helps stabilize the heart's electrical activity and might reduce how often arrhythmias occur. But it's not a replacement for an ICD in high-risk cases.
What about activity? If you have Brugada, can you still exercise? Especially thinking about that athlete.
It's a discussion to have with a cardiologist. Often, for high-risk individuals, especially those with an ICD, avoiding highly competitive or strenuous sports is advised. But moderate regular exercise is usually encouraged for overall health, always under medical guidance.
And going back to finding it early, things like cardiac screening programs in schools or sports leagues, do they help?
They certainly have the potential to identify individuals who might need further evaluation. Organizations like the CESAD's Foundation, Sudden Arrhythmia Death Syndromes Foundation, advocate for these. And, of course, pushing for wider public access to AEDs and CPR training is critical.
Yeah, that stat about AEDs is compelling.
It is. Studies show survival rates jump dramatically, maybe by 70%, if defibrillation happens within the first few minutes. Time is absolutely critical.
So, living with this condition, that sounds like it requires constant awareness.
It really does. Vigilance is key. It means working very closely with your cardiologist, having regular checkups, maybe adjustments to treatment over time.
And the family aspect seems huge, too.
Critically important. Because it's often inherited, genetic counseling and testing for first-degree relatives, parents, siblings, children is strongly recommended once someone is diagnosed. It helps identify others who might be at risk.
I can only imagine the psychological side of this. Knowing you have this hidden risk, that must be tough.
It's a very significant factor. The fear, the anxiety about a sudden event, it can be overwhelming. Depression isn't uncommon.
How do people cope with that?
Support systems are vital. Connecting with others through support groups, either in person or online, can make a huge difference. Just sharing experiences helps. And professional help counseling, therapy, learning stress management techniques like mindfulness can be incredibly beneficial for managing anxiety and improving quality of life.
So it's manageable, but it takes effort on multiple fronts.
Absolutely. It's about staying informed, Being proactive with your medical care, avoiding triggers, and seeking emotional support when you need it. People with Brugada syndrome can and do live full and meaningful lives while actively managing their risks.
Okay, let's try and pull this all together then. We've explored Brugada syndrome, this really complex, often hidden heart rhythm disorder.
Yeah, rooted in the heart's electrical system, driven largely by genetics, but then potentially unmasked by some surprising triggers like fever or certain meds.
We saw how diagnosis is tricky, needing specific tests like ECGs and sometimes provocation tests because that key pattern can just come and go.
And management has to be really tailored lifestyle changes and trigger avoidance for some, maybe an ICD implant for those at higher risk.
And those real life stories, like the young athlete, they just hammer home how vital awareness is and how crucial quick action with CPR and AEDs can be. They literally save lives.
They really do. It highlights that constant challenge. How do we find this condition when it's hiding in plain sight, often to people who seem perfectly healthy?
Which leaves us with a pretty big question to think about, doesn't it?
It does. Given all these challenges, the hidden nature of the diagnostic hurdles, the potential for sudden death, it raises a really important consideration for us all.
So here's something for you to think about. How do we as a society effectively balance pushing for wider screening to catch this hidden killer against the very real practical costs, the potential for anxiety and false positives, and the overall impact these efforts have on individuals and our healthcare systems?